I've never shared that particular feeling that there would be a veritable tsunami of claims against physicians in particular as a consequence of the pandemic, because we're dealing with an entity that in the beginning had no standard of care for treatment, had no cure for the disease itself. And so I always thought physicians would be a hard target. And in fact, what we've seen is about 15,000 claims, that's an estimate, filed nationally for the treatment of COVID-19 or for people getting COVID-19 and trying to blame someone for their disease. Most of those claims were filed against long-term care centers where people were housed, and they're alleging that proper infection control techniques weren't followed, and they're suing that entity for their disease, or their heirs are suing the entity for the death of their loved ones. A lot of people think that doctors will be the next in line to see lawsuits. Some experts predict that plaintiffs' lawyers are holding back intentionally, waiting for the halo that the pandemic has created for healthcare providers to fade away and make them an easier target in the eyes of juries. Some people believe that plaintiffs' lawyers are holding back to try to get a handle on how immunities are dealt with in these other lawsuits against long-term care providers, because they're an easier target than a physician would be in terms of proving the case and recovering damages. So there's a belief that there will be lawsuits that come for the delay in treatment and diagnosis of COVID-19 against physicians. Certainly in the future, now that we're seeing drugs that can actually treat the illness, like Regeneron or the antiviral pills that are being developed, the timeliness of a diagnosis will be much more important than it has been in the past to be able to administer these drugs. So will we see claims in the future against physicians? Yes. Will it be a surge? Will it be a tsunami? I'm still not sure that that will be the case, but we will see more claims than we have seen since the pandemic began against physicians.